I have swelling under my right eye only. One doctor suggested fillers, while another one blepharoplasty. Any suggestions? What could be the reason of swelling under one eye only? Which treatment is better for under eye treatment? Fillers or blepharoplasty?
Thank you for your question. You've submitted a single photo and you're describing a swelling that you feel is only under your right eye, and that you're a little confused because one doctor recommended blepharoplasty, another one recommended filler. So what you're describing is a situation that is confusing patients more and more these days because of the many options that are available and the conflicting interests of the people offering those options. So let's begin with just first identifying the swelling. If you're referring to this large swelling that's below your eyelid, below the eyelid margin, I should say, that's fairly prominent when you are looking up, well, that area of swelling is called lower eyelid fat prolapse. Now, on your left eye, it appears you also have lower eyelid fat prolapse. So then the question is, what's better, blepharoplasty or injection? Well, this question comes up in our practice pretty much every day. As a cosmetic oculofacial plastic surgeon, I am continuously seeing patients who have had fillers done who had very significant fat pockets under their eyes. So I do have a little bit of a bias because most of these people who come for revision or some kind of correction ultimately require that I actually inject them with a material called hyaluronidase to dissolve their filler, because when they had this filler, the puffy bag became even puffier and the whole area looked swollen. There is a place for fillers, and when someone has a small amount of fat prolapse and when they come to our practice, we offer them that option of being able to camouflage a little bit of that fat prolapse with a filler before they're ready for a blepharoplasty. So, from my perspective, looking at your photo, it's pretty clear to me that if you were someone who came to my practice, I would recommend blepharoplasty, and I would say that fillers are simply just not going to be beneficial to you. Now, that doesn't mean fillers in other areas can't be helpful. A lot of times when someone has a situation like yours, they also have volume loss in the cheek area. So we may add volume in the cheek area to kind of offset the balance, the imbalance between the lower eyelid fat prolapse and the hollowing of the cheek. But ultimately, for herniated fat, for fat that's pushed forward, lower eyelid blepharoplasty is, in my opinion, the best solution. So, with that being said, I think you may need to just first evaluate who the doctors you saw were. Were they both surgeons? And if they were both surgeons, understand why one surgeon leaned towards fillers. And I would also say that it might be worthwhile to say, well, what if you don't like the fillers? What are your options? Because certainly people who have these fillers done, who have puffy under eye bags, are often pretty angry and would have preferred not to have it done rather than to have something done where they just looked fairly swollen. So it's all about selection and making intelligent decisions. If you're afraid of surgery, well, you may be better off doing nothing rather than getting an injectable. But I think that in your situation, surgery would be beneficial. And we help alleviate the fear of surgery in our patients because in our practice, our facilities are within our office and we have Joint Commission approved facilities. So we kind of try to make the surgery as less scary for the patients by having a more of a family type environment where they know everybody, they're comfortable, as opposed to going to a hospital or surgery center where there's a little bit of depersonalization. And the procedures we do for lower eyelid blepharoplasty are done under local anesthesia with light IV sedation, which means that there's often a very quick recovery. And many times I've even suggested to our patients that if you look at our patients after lower eyelid blepharoplasty, and I've been doing this for over 20 years, the amount of swelling and bruising is often less than people will have if they have injectable fillers. We've seen patients come to our office who have tremendous bruising and a lot of swelling from having injectables. So it's not like they were avoiding the undesirable effects of having surgery. With surgery, we have a lot of control over that, and so our patients routinely don't look very swollen or very bruised after a week, and they don't have the bags anymore. So that's something for you to learn, and hopefully this was helpful to you. So I wish you the best of luck, and thank you for your question.